Let's jump right into this explainer. Long before we had modern lab tests and fancy ultrasounds, medical professionals actually had to rely on these incredible physiological clues to detect a new pregnancy. Today, we're diving straight into Nurse Sarah's NCLEX maternity review to decode one of the very first and honestly most fascinating indicators of human life. It's called Goodell Sign, and it's just a brilliant look at how the human body signals these profound changes, literally almost from the very moment they begin. So think about it. How exactly do we spot a pregnancy before a positive test is ever even run? Well, it really comes down to physical, tangible clues. For nursing students, or really any healthcare provider, figuring out how the body physically alters its own structure is an absolutely critical skill. We're going to explore how these early bodily changes can be picked up through a standard maternity assessment way before the familiar signs of pregnancy become visible to the outside world. And that brings us to Goodell Sign. It was named after a prominent American gynecologist, Dr. William Goodell, and this specific physical change is a total foundational tool in early maternity assessment. Dr. Goodell realized something huge. By observing a reliable, measurable shift in the body, providers could essentially just feel the early stages of gestation. Identifying and documenting this specific change, that became a cornerstone of early clinical diagnostics. It basically allowed healthcare providers to evaluate a patient's status with a really practiced, observant touch, instead of just relying on the symptoms a patient might report. Honestly, what's truly remarkable here is the sheer speed at which this happens. This physiological shift doesn't just wait around for the second or third trimester. No, it happens right in that supercritical 4 to 8 week window of early pregnancy. I mean, think about that for a second. At week 1, the anatomy is at its standard firm baseline, but by week 4, the onset of Goodell Sign is already kicking in. And by week 8, this alteration is fully 100% established. It's a rapid, dramatic transformation that just highlights how insanely fast the human body gears up to support a new pregnancy. Now, the why behind this rapid timeline is what's really captivating. Goodell Sign is, at its core, the physical softening of the cervix, and it happens entirely because of increased vascularization. Basically, a massive surge of blood flow completely transforms the cervix from this rigid baseline state into something squishy and gel-like. This isn't just some random symptom, right? It's a highly purposeful adaptation by the body. It's literally redirecting biological resources and blood supply exactly where they're going to be needed most. But here's the catch, and it brilliantly illustrates a vital concept in medical diagnostics: the clinical threshold of proof. In maternity nursing, there's a really strict categorization of signs, and Goodell Sign is officially classified as just a probable sign of pregnancy. Now, why just probable? Well, because its presence strongly suggests a patient might be pregnant, but actually, scratch that. It's more like similar vascular changes and softening can happen in totally different non-pregnancy related conditions too. So to cross that threshold into absolute positive proof, medical professionals need additional definitive testing. We're talking detecting the HCG hormone through a pregnancy test or using an ultrasound. Basically, Goodell Sign points us in the right direction, but the technology, that gives us the final, indisputable positive evidence. Okay, if you're studying for your NCLEX or gearing up for clinical practice, here is an absolute lifesaver of a memory trick from Nurse Sarah. Medical terminology can be so dense, but just look at the word itself, Goodell. It literally has the word good right there. So just remember that the cervix is getting good and soft. It's such a simple, brilliant trick, but it will instantly trigger the right definition in your head on test day. Just remember the transition from a firm state to being good, soft, squishy, and gel-like. Now, mastering maternity nursing requires understanding dozens of these specific physiological signs and clinical definitions. So if you want to absolutely excel in your assessments, Nurse Sarah highly recommends checking out her dedicated study guides. They're structured perfectly for focused learners. You can grab them in a digital format over at nursesarmor.com if you're the type who prefers studying on a tablet. Or if you're like me and love to highlight and scribble notes in the margins, the paperback version is readily available right on Amazon.com. They're just an excellent resource for breaking down all these complex medical transitions into clear, retainable facts. Wrapping up this explainer, this rapid, hidden transformation really gives us an incredible appreciation for human biology, doesn't it? We've seen exactly how a surge in blood flow between weeks 4 and 8 fundamentally changes the body's structure, offering this vital, probable clue to medical professionals way before a single ultrasound is ever done. And honestly, if the body is quietly executing this whole gel-like transformation so early on, it really leaves us wondering what other hidden physiological secrets and rapid adaptations is early pregnancy keeping just beneath the surface.